I'm here today with Dr. Kasia Machaczek and Dr. Helen Quirk, who are going to talk to you about their collaboration project that we've recently funded through the collaboration funding pot. So over to Kasia and Helen.
Thanks, Emily. So we just introduce ourselves first, and then we can talk a little bit about the project. So I'm Helen Quirk. I'm a research fellow at the University of Sheffield. I'm currently funded by a School of Public Health Research postdoc launching fellowship. And my area of interest is in physical activity and health promotion.
My name is Kasia Machaczek, and I'm a research fellow from Sheffield Hallam University, and I'm based in Advanced Wellbeing Research Center. And my research interest lies in the area of physical activity and utilizing physical activity to help people to improve their mental and physical health, individuals with mental ill health.
Great, and the title of kind of the project that we're doing as part of the Closing the Gap Fund is examining and implementing whole systems approaches to physical activity for aiding mental health recovery. And we are a collaborative team. So as well as Kasia and myself, we've got Dr. Jo Firth, who's a Presidential Fellow in the Division of Psychology and Mental Health at the University of Manchester. And we've got Dr. Rebecca Carney, who's a Research Associate in the Youth and Mental Health Research Unit at the Greater Manchester Mental Health NHS Foundation Trust. We've got Stephanie Delahaye, who's our PPI representative and founder of Survivors of Depression in Transition. And we're also supported by Professors Rob Copeland and Liddy Goyder. Rob's a Professor of Physical Activity and Health and Director of the Advanced Wellbeing Research Centre at Sheffield Hallam University. And Liddy is Professor of Public Health in the School of Health and Related Research at the University of Sheffield. So we've got nice collaboration between Sheffield and Manchester in this project. And together, we're all really passionate about physical activity and enabling people to move more. And we know now more than ever, I think, that there are huge health benefits to be gained from being active and socialising with others. And we also know that people face barriers to being active, but for people living with mental health conditions and serious mental ill health, it's harder to start being active and to stay active. And the reality is that although they might want to be more active, there are many things that get in the way of that. And we don't necessarily mean individual things like motivation or willpower, but more about the context and the things around us in the kind of social and environment and the physical environment around us that interact in a way that either helps or makes it harder to be active. Because, behaviour isn't a simple thing. And if it was, I don't think we'd need to be doing this project. It's more complex than that. And Kasia will go on to explain this kind of whole systems approach.
Yes, thank you, Helen. So complex system perspective and methods that help researchers to generate evidence that takes into account the complexity of the real world environment, and it involves considering the bigger picture. So, for example, we may want to, it can help researchers to understand how interactions with the wider system within which it is based affect its effectiveness, but also how those interactions generate or reduce health inequalities. And whole systems interventions are interventions which those are complex interventions which attempt or seek to change a number of parts of the system simultaneously. And usually, whole system researchers and approaches gain an insight from the perspectives of multiple stakeholders. And why, as Helen said, the participation in physical activity and helping individuals with severe mental illness to move a bit more and also reduce the amount of time they spend in sedentary activities is challenging, and physical inactivity has complex underpinnings. And if we take one of the perspectives, there are a number we could discuss. However, we don't have the time to do that today. But we know, for example, that individuals with severe mental illness are impoverished, disadvantaged, marginalized, and we also know that poverty has been linked to physical inactivity generated health inequalities. Individuals living in deprived communities may not have access to physical activity opportunities in the community, or they may not be able to afford the right gear, even if we offer them free access, or they may not be able to use public transport to get to places. And also in Marmot reviews, sort of underscored the importance of taking into consideration the wider system and context when affecting health-related behaviors. And we really believe that the use of physical activity as an intervention for individuals with severe mental illness requires taking into account all of those aspects and bringing together partners and stakeholders from different parts of the system and trying to together to build something or to implement, develop, implement, adapt, and evaluate a number of interventions which basically create environment and facilitate, help people move more. But actually, a whole system approach, it's not, or interventions are not easy to be implemented and or developed. And even within the NHS, the institutionalization and professional separation of mental and physical care often results in disjoint approaches, which really miss opportunities to address people's multiple needs. So we have a lot of work to do. And also what is important, I haven't mentioned, one provider cannot really address all of those needs to be able, to help people to move more. And we therefore would like to use the funding we receive from the Closing Gap Network to start the process of building whole systems interventions. And to start with mapping the system. What are the active parts of the system, parts which we can affect and change? And what are the boundaries? What is the environment which we are much less likely to affect? Also, how various stakeholders can work together? How can we help them? What do they need from us so that they can get on board and see that, or helping individuals with severe mental illness as their role? How we can facilitate collaborative working. So it is quite complex, and it requires, I think, taking very careful steps and gaining trust and facilitating discussions with partners. So I will now hand over to Helen, who will tell you about the objectives of our project, and then I will tell you about our plans for the future.
Great, thanks, Kasia. So, yeah, like we've said, so we're as a kind of a research team, we're all passionate about improving access and provision and promotion of physical activity for people living with serious mental illness. And yeah, we're really keen to expand our network and link up with other stakeholders, including and especially including people with lived experience of serious mental illness, who all share this passion, and just to really come together to fully understand the problem and to understand this big complex system that Kasia's mentioned, and to start to make tracks in addressing the issues, and yeah, just really supporting people to and enabling them to move more. But like Kasia said, it's not an easy thing, and it isn't a simple or quick process. So this funding pot is really good kind of stepping stone for us, really, just to start to do this. In terms of what we plan to do, then it's about bringing people together. We want to kind of create an engaged kind of stakeholder network, where we build on existing connections, but also, tap into new fields, new areas of work. And in order to do that, we're going to essentially do some engagement work. So we're going to hold some meetings and workshops with both stakeholders and people with lived experience. And we really want to start to get a feel for what this mapping process might look like, who we need to engage with, who we need to talk to, who we need in the room to have those conversations and to really understand the system. Yeah, talking to people with lived experience is obviously a priority for us, because we need to understand, the potential and from their point of view. Is there anything else, Kasia, you want me to cover in that bit?
I think probably important thing we've talked about is that we would like to engage individuals who are really interested in physical activity and would like to increase their physical activity levels and reduce the amount of time they spend in sedentary activities. But we also would like to engage and individuals who are not interested in physical activity. We would like to really learn from them why that might be the case, and start a dialogue, because I think that knowledge can really help us improve our future implementation and research efforts.
Yeah, I think that's really important. And yeah, I guess, like I said, this is an important stepping stone, and kind of the preparation, or the preparation we need in order to do further work, which I think you're going to cover, Kasia.
Yes. So what we would like to do in the first instance, we would like to map the system, understand what are the parts of the system, and also what are the boundaries of the system. And that requires a comprehensive work with multiple stakeholders. So as our next step, we would like to apply for funding to do exactly that. And then all of us together would like to develop whole systems interventions.
Thank you, Kasia and Helen, today for talking to us about your physical activity project. We're really excited that we've been able to fund the early work in this. And it's something we feel very strongly about in Closing the Gap, that we should be able to help people to move more and be less sedentary. So thanks for joining us today on the Research Sofa, and we look forward to hearing the results of your project and seeing how it develops. Thank you and goodbye.
Thank you.
Thank you.